The following segment is sponsored by Center for Sports Medicine.
Bryan Clary joining us today. He's a board-certified sports clinical specialist at Center for Sports Medicine and Orthopaedics. Welcome to the show.
Thanks, James. Thanks for having me.
I'm glad you're on board with us this afternoon. All right, what is the Center for Sports Medicine's involvement with COVID-19?
So the center has been, primarily patients that are coming in. Our primary involvement is to keep them safe, keep the employees of Center for Sports Medicine safe, and make sure that we're a place that's following the appropriate guidelines. But our primary involvement has been truly in our sports medicine side. And we've got athletic trainers in North Georgia and Hamilton and Bradley County, as well as a couple professional soccer teams, and making sure that we are supporting our athletic trainers who are in turn knowledgeable and skilled and able to lead their organizations through the guidelines.
This time of year, we've got all kinds of sports going on, baseball, right, and softball and soccer and tennis and golf and of course football. And speaking of football, there's a lot of high school games that are still going on. There's a lot of high school sports that have been canceled. But what are the barriers for returning to a sport after a COVID diagnosis?
So after barriers to any sport right now are just making sure that everybody is following what guidelines they can to keep those around them safe and not themselves be a means of potentially spreading COVID. But, we're at a point now where this has been going on since, really since March, we'll say. And there are people who have had COVID and are now hoping to get back into sport. And I think that it can be done and it can be done safely. But there's a couple guidelines to keep with. So, they're recommending that you have 14 days post-COVID diagnosis before you even attempt to go back to sport, and at least 7 days symptom-free. So COVID is primarily going to be a respiratory illness, but it's affecting all kinds of body systems, cardiac, pulmonary, musculoskeletal for any means. And I think your start to returning to sport is going to be with your primary care physician and getting an appropriate medical checkup. And from there, it's just easing back in, making sure that you are not going out thinking that you're going to be at the same level of health as you were pre-illness.
Objectively, what is the recommended data for how to return to a sport?
So it's pretty vague in terms of how to return, as long as you are sticking with the 14 days that you need to self-isolate if you have been positively diagnosed, and then you need to wait about 7 days before you can symptom-free before you return. And for some that may be pretty quick. For some, you may have a lingering dry cough or muscle ache or illness may go on as long as 5 weeks. But I think you want to wait until all that is gone before you can resume getting back into exercise.
The Saturday clinic, are you still holding the Saturday clinic?
Saturday clinic will be on again this year in the same way we've had it in the past at our McCallie clinic, at our Cleveland clinic as well. It will be run through second week of November in McCallie, first week of November in Cleveland. Same thing. You show up, you'll be seen, you'll be given what you need, you'll be given a diagnosis, and a plan can start for your return to sport that week.
Bryan Clary, thank you very much for joining us today. Some good info.
Thank you.
For more information, Center for Sports Medicine and Orthopaedics. Here's their telephone number. Here's the outside of Chattanooga telephone number, 1-800-757-2696, sportmed.com.